President Uhuru Kenyatta has announced a 5% rise in minimum wage. He's also called for dialogue to solve ongoing strikes. The announcement comes a day after employers warned another wage increase was not possible. They claimed such a move would hurt the economy, which is just beginning to recover from last year's battering. The Kenya Association of Manufacturers says the industry is yet to gather steam after being hit by high inflation rates, a drought and prolonged electioneering. Right, let's get more insights from Dr. Ekwaro Obuku. He is the president of the Uganda Medical Association and joins us live from Kampala. Dr. Obuku, today was Labor Day or International Workers' Day. What is there to celebrate?
Good evening, viewers. Well, in Uganda, it has been a very dramatic day with the head of state making some pronouncements. Nonetheless, as workers, of course, we commemorate and celebrate those who have fallen in their line of work today. Specifically as health workers, our utmost consideration is the patient. So irrespective of the challenges, we have managed to deliver very important health outcomes over the past 5 years. A very key one is that maternal mortality has dropped from over 500 per 100,000 to less than 350 per 100,000 in Uganda, despite the challenges that motivated an industrial action. What has happened is that there has been an increase in skilled birth attendants, with midwives being the heroes there, of course, and supported by doctors who are performing cesarean section. So yes, there is a lot to celebrate in terms of achieving our outcomes of ensuring that we minimize deaths and improve the well-being of Ugandans. Very recently, the government also made pronouncements that they will prioritize scientists, particularly health workers, and bump up their salaries. This is really something about sharing wealth, which is created by the country, and reducing the disparity gap of the wealth generated by the country. And we think that is something we celebrate. Of course, we are preempting, and it's not yet time because the budget will be announced in the next coming month.
Right. We know Ugandan doctors went on strike last year, pressing for better pay and working conditions. What has changed?
Well, I wanted to clarify that the number one consideration, or agenda number one for the industrial action or strike, if you like, was really about the shortages of medicines and medical technologies, which was affecting the effectiveness of doctors. I mean, you go somewhere and you don't have medicine after you've done your diagnosis, or you don't even have support, diagnostic support. So your ability to produce your work was limited by absence of these facilities in the health units. Actually, we argued that there is a policy of government of free health care, but the facilities were free of this health care. So that was agenda number one. Agenda number three, which was about the working conditions in terms of remuneration, housing, etc., is what also motivated this industrial action. And we thought that government had banned further recruitment in public service. People were retiring and not being replaced. Salaries had remained stagnant for a very long time. And we addressed His Excellency the President to these issues. So far, the government has promised to increase the budget for supplies of medicines and other medical technologies by about 17–20% to the national medical stores. Obviously, the government is also rehabilitating hospitals and constructing new ones, which is a positive development in terms of physical infrastructure. However, in terms of human capital or human resources infrastructure, this is what we have been engaging government about, to prioritize and remunerate salaries. They have promised to increase salaries. We have seen reports, newspaper reports. We have not seen official communication papers from the government, and we are waiting for this possibly when the budget is read in the next 1 month or so.
Now, Uganda is one of the countries importing Cuban doctors, just like Kenya. In your case, President Museveni was quoted saying that some of you behaved badly. How should the shortage be resolved?
First of all, I'd like to highlight to the President and inform him that there is no doctor who behaved badly. Doctors during the industrial action followed the law, which is provided for by international labor organizations, the international laws, as well as the local labor laws. Secondly, we followed the guidelines of the World Medical Association, which provides for handling emergency care when doctors are demonstrating or having industrial action, and we follow those guidelines strictly to the letter. The third thing, obviously, is that that His Excellency the President talked about doctors behaving badly, but again, according to the 1998 Act of Uganda Medical and Dental Practitioners Council, that body is the one which is given the authority by the law to punish errant doctors, and commonly it handles professional misconduct or malpractice. So really, the President is out of order, and he needs to be informed that doctors were following the law.
All right, let's leave it there for now. We appreciate those insights. Thank you for joining us, Dr. Ekwaro Obuku, live for us there in Kampala.